Good morning or good afternoon, whatever time it is for you. What we're going to do today is I want to go over some frequently asked questions about stem cell therapy. So we're going to go over the 5 top questions that I get in my office since we started these therapies. Number 1, the biggest question I get is, where do we get the stem cells from? So these are not coming from aborted fetal tissue. They're not coming from anything like that. These are not embryonic stem cells that we're using. What we're using is umbilical cord stem cells. And these come from healthy mom, healthy baby. 6 months into the pregnancy, the mother is asked if she wants to donate. If she does, then she's screened, and then she's screened again at birth. These are C-sections. So what they do is they take that umbilical cord then at the birth time, then they pull the cord blood out of it, they separate the stem cells, they count them through something called flow cytometry, and then they cryo-freeze them at -80 degrees. And then we get them the day before we do stem cell injections, and these are then at the time of injection are thawed out and then they're injected. So these are literally day 0 cells, the most viable, healthy cells that we have or that we can get. Second question would be, are they FDA approved? FDA only approves drugs. They don't approve natural forms of therapy, but these are FDA regulated. So number 2, no, they are not FDA approved, but they are FDA regulated. The labs are. Are they safe? Well, not only does the FDA regulate the labs, but also the American Association of Blood Banks, American Association of Tissue Banks, and the National Institute of Health. Just like blood you'd get from a hospital, how it's screened. These are screened for the same types of diseases and those types of things. So you don't have to worry about them. They're extremely safe. Do they work? Well, over 30-some thousand, maybe 40,000 injections have been done with tremendous results. Probably one of the best things is knees. It's probably over a 90% success rate. But when we're looking at autoimmune conditions or joints in general respond really well. Autoimmunity, COPD, some of these other, if it's an itis or an osis, if the condition has an inflammatory component, what these cells do is they decrease inflammation, modulate the immune system, and regenerate tissue. So if there's a component to that and whatever the disease process that's going on, these are actually treating the underlying effects of these things, regenerating tissue, not treating the actual disease itself. So they can handle a lot of the underlying causes of these problems. Does insurance cover it? The answer to that would be no. At this time, it is a natural product. Insurance is not covering. So if you have any additional questions, you can call our office at 614-367-9355. We'd be happy to answer them. You guys have a great day.